consent given. But was it actually valid? If you're a learning disability nursing student, understanding capacity and consent is essential for exams, OSCs, placements, and safe practice. Have you ever wondered if a patient truly understands the treatment you are offering? This is a question you will face every single day in your career. It sits at the very heart of good, ethical care. Getting it right is not just about passing your exams or completing your placements successfully, protecting your patients, respecting their rights, practicing safely and legally. Many students find this topic tricky. The line between a person's right to choose and your duty to care can seem blurry, but it doesn't have to be. This is a skill you can learn, master, and use with confidence. Today, we are going to demystify one of the most important pieces of law for anyone in healthcare, the Mental Capacity Act, or MCA. We will break it down into simple, manageable parts. We will define what capacity really means. We will walk through the 5 principles. You will learn the practical, step-by-step method for assessing if someone can make a decision for themselves. This is your toolkit for safe and compassionate practice. By the end of our time together, you will understand the crucial difference between capacity and consent. You will know how to support someone to make their own choices, and what to do when they cannot. We will also highlight the common mistakes students make so you can avoid them. This is about building your confidence. It is about making you a better, safer, and more compassionate healthcare professional. Let's begin this important journey. Every adult has the right to make their own decisions. Our job is to assume they can, and to help them do so wherever possible. This principle is your starting point. Always, it is the foundation upon which everything else is built. Remembering this single point will steer you correctly in even the most complex situations. It is the golden rule of the Mental Capacity Act. So let's get into the details and equip you with the knowledge you need to excel. Let's start with the absolute basics. What is capacity? In one simple line, capacity is the ability to make a specific decision at the time it needs to be made. Notice those key words: specific decision and at the time. This is vital. Capacity is not a blanket judgment about a person. Someone might have the capacity to decide what to have for lunch, but not have the capacity to make a complex decision about their housing. It can also change. A person may lack capacity in the morning when they are drowsy, but regain it in the afternoon. It is not fixed. To guide us, the Mental Capacity Act 2005 gives us 5 clear principles. Think of them as your 5 guiding lights. First, always assume a person has capacity unless it's established they lack it. This is your default setting. Second, take all practical steps to help someone make a decision. Use simple language. Use pictures. Give them more time. It's about empowerment. We are helpers, not gatekeepers. Third, don't treat someone as unable just because they make an unwise decision. We all make choices others might disagree with. That is our right. Your role is to assess the person's ability, not judge the choice. Fourth, if someone lacks capacity, decisions made for them must be in their best interests. It's a careful, considered process. It is about their welfare, not our convenience. Finally, consider whether the same purpose can be achieved in a less restrictive way. This is the least restrictive option. Example: daily visits for medication versus moving into a care home. Always choose the option that gives the person the most independence possible. These 5 principles are the ethical foundation of your practice. We'll link theory to law, policy, key authors, and evidence-based practice, so your exam answers are structured, ethical, and professional. So, how do you actually assess capacity? The law gives us a clear 4-step functional test. This is your practical checklist. You need to use this every single time you have a doubt about capacity, and you absolutely must be able to explain it in an exam. Remember, the person only needs to fail one of these 4 stages to be assessed as lacking capacity for that specific decision. The first step is, can the person understand the information relevant to the decision? Give them the information first in a way they can process. Use easy words. Use pictures. Break it down. Understand. Step 2. Can the person retain that information long enough to make the decision? This isn't a memory test about what they had for breakfast. It's about holding the key points long enough to weigh them. Ask them to tell back the main pros and cons. Can you tell me the two main things this medication is for? Retain. Step 3. Can the person use or weigh that information in deciding? It's about the thinking process, not whether the choice is good or bad. Look for ability to consider consequences. What do you think will happen if you have the operation? What matters most to you in this situation? This step explores their ability to reason and see the relevance of the information to their own life. Weigh. Step 4. Can the person communicate their decision? This communication can be verbal or it can be through non-verbal means. Sign language point to a picture, blink, the method doesn't matter, and they just must convey a clear choice. Infographic highlight. Communicate. If they pass all 4 stages, they have capacity, and you must respect it. If they cannot manage one or more steps, even with support, they are assessed as lacking capacity for that decision. When you have followed the 4-step check and formally assessed that a person lacks capacity, you cannot just walk away. Your duty of care means you may need to make a decision on their behalf. This is called a best interests decision. This is not about what you would want or what their family wants. It is about what is best for that individual person. The MCA states you must consider the person's past wishes and present wishes and feelings. You must involve the person in the decision as much as you possibly can. Their voice, however faint, should be heard. Making a best interest decision is a serious responsibility. It requires 2 very important actions from you. First, you must consult with others. Talk to the people who know the person best. Family, friends, carers. Ask them about the person's values, beliefs, and past expressed wishes. Has the person made an advanced decision to refuse treatment? Is there a lasting power of attorney for health and welfare in place? You must check. You are gathering clues to build a picture of who this person is. Let's use a brief example from placement. Jenny is 23 and has a learning disability. She needs a flu vaccine. The nurse, you, explains what it is for, using an easy-read leaflet with pictures. You explain a small needle in the arm. It might be sore, but it will stop her from getting very sick. Jenny nods.
And can repeat that the shot stops the bad sick.
She can also say she doesn't like needles. She weighs these 2 facts
And says no needle today.
She is understood, retained, weighed, and communicated. She has capacity, and you must respect her decision. Document this, and perhaps offer to talk about it again another day. Now, imagine Jenny could not do one of those steps. Let's say she could not understand that the vaccine was to prevent future illness, despite your best efforts with pictures and simple words. You would then assess her as lacking capacity for this decision. You would move to a best interest decision. You talk to her parents, who say Jenny hates being ill and has always had her vaccines, weighing the minor distress of the injection against the major risk of her getting seriously ill from flu, and considering her past actions. You and the team decide it is in her best interest to have the vaccine. You would still try to make the experience as calm as possible for her. Never write, the patient lacks capacity because they have a learning disability. Capacity is decision-specific, not diagnosis-specific. You must state which of the 4 steps the person cannot do. Example, the patient lacks capacity to consent to surgery. They are unable to retain the information about the risks involved for long enough to weigh them. Mistake 2, forgetting to show you're working. It's not enough to say you supported a person. Say how. Did you use a leaflet? Did you involve a family member? Did you use a translator? Did you give them more time and come back later? In an exam, describe the practical steps you took to satisfy the second principle of the MCA. That shows the examiner the law is about empowerment, not just assessment. You're actively trying to help the person make their own choice. Mistake 3, poor documentation. If it's not written down, it did not happen. In an exam, if you do not write it down, you do not get the marks. Always conclude by stating what you would record. Write down the decision in question, the steps you took to support the person, the outcome of your 4-step capacity assessment, and, if applicable, the reasons for your best interest decision. This shows you're a safe, accountable, professional practitioner. Clear records protect your patient, protect you, and prove your competence. So here's your clear action. Whenever you think about consent, have this checklist in mind. Assume capacity. Try to support them. If you have doubts, use the 4-step test. Understand, retain, weigh, communicate. Practice this on placement. Use it to structure your revision. Write it out in your exam answers. This simple, structured approach will bring clarity and show you're practicing safely and ethically. You can do this. Keep people at the center of everything you do. You will not go wrong. All the best. If you want to pass learning disability nursing exams and feel confident in practice, subscribe to Mental Health Scholars Hub. Comment MCA if you want a full exam-ready answer next.